Welcome to Periop Talk. My name is Renee Battier, Vice President of Nursing at AORN, and I'm excited to be here today with my good friend and colleague, Dr. Lisa Spruce, Senior Director of Evidence-Based Practice at AORN. We're going to discuss our newest guideline, implementation of ERAS, a new standard of care that can really impact and improve care for all patients. ERAS, or Enhanced Recovery After Surgery, it's a great example of how a new guideline comes about as a response to changes and developments in the perioperative care of patients. So tell us a little bit about how this came to be.
Well, I have to say, Renee, that this is such a passion of mine, this guideline. We believe that ERAS is the standard of care that should be implemented to all patients undergoing surgery. It is a comprehensive, evidence-based model of care, and the guideline is focused on how to implement that care. You know, ERAS has been around for a while. It was established in Europe. There is an ERAS society that gives guidance on some surgery-specific ERAS protocols, but this guideline, we can use ERAS in every single patient undergoing surgery. So it is very exciting to be able to bring this to our perioperative nurses.
So tell us about key stakeholders in bringing this to be. You're right, this isn't a new topic, but this was a new choice for us to put it into a guideline. So tell us about that and who your key stakeholders were.
Yeah. We had a lot of key stakeholders that were involved in reviewing the guideline, developing the guideline, because it is very interdisciplinary, ERAS. So we had perioperative nurses, we had surgeons, we have anesthesia providers, we had pharmacists, we had infection preventionists, and we had the members of our guideline advisory board, which represent quite a few organizations and perioperative nurses. So we had a lot of people look at it, a lot of people giving us feedback. So it was great to have that collaboration.
It really reflects the perioperative team and all the care that comes together for surgery in really a beautiful way.
Mm-hmm.
So let's go into some of the different phases of care and what some key recommendations are there. And so let's talk first about pre-op preparation, both the education as well as some of the clinical care in the guideline.
Yeah, I think implementing patient-focused interventions in ERAS are really quite simple. They really are, and they're easy to put in place. And we do provide guidance on, preoperative screening, on how to optimize the patient's health before surgery, comprehensive education that we need to give them in an ERAS program. It includes preparing the patient for surgery by giving them the appropriate fasting guidelines, by conducting risk assessments, by implementing surgical site infection prevention bundles, warming the patient, preparing the patient for multimodal pain management, because that is a strategic part of this protocol, because we want to target various physiological pathways to prevent pain, multimodal analgesia, that it aims to optimize that pain control, because we do want to minimize the adverse effects associated with narcotic pain medicine. So that is a big focus of the program.
I know in my background in putting these protocols into place, often it was the pre-op and that took the most coordination and collaboration to really make that be effective.
I agree. That's a lot of planning on that.
It's a lot of planning, but it's powerful in the impact. So tell us a little bit about the intraoperative care elements and how those came together in this implementation guideline.
Yeah, so these are all pretty much driven by our anesthesia professionals, which is why they had a large stake in reviewing this guideline and giving us feedback. But they provide a standardized anesthesia protocol for every patient. They maintain a euvolemic state, which is tailored to each individual patient for fluid management and monitoring, which is really important. And then they are going to continue that multimodal analgesia that started preoperatively. It will continue intraoperatively. And it includes a variety of techniques. There's quite a few multimodal analgesia techniques, and we do outline those in the guideline. And we also emphasize the importance of minimally invasive surgery techniques to be used when possible.
Mm-hmm.
The use of these techniques does numerous advantages for patients. including reduced intraoperative complications, decreased blood loss, improved postoperative pain management, and shorter hospital stays, better cosmetic outcomes, and faster recovery to normal functioning. So there's a lot of advantages with all of these intraoperative interventions that we recommend.
Makes a huge difference in all that coordination. So what about the postoperative period? What's the focus from an ERAS perspective on the postoperative element?
I think for patients, especially, it's trying to minimize that postoperative pain, which we are going to have done by implementing pre-op and intra-op interventions. And then it's really to encourage that early mobilization, getting them out of that bed, getting them moving, getting an early return to a normal diet. So getting oral intake started as quickly as possible. And the other thing that we emphasize is if there's any indwelling catheters or drains that were placed, is to removing those as soon as possible. And then there's some focus on some activities post-surgery, so after they go home. Do they need physical therapy? Do they need some kind of extra interventions to help them get moving and get back to normal quickly?
Again, coordination across the team and a consistent message. So for a healthcare facility that's going to be effective in these protocols, what are some of the recommendations?
Well, I think number one, it's going to take careful planning with a multidisciplinary team, collaboration. You've got to have a structured approach to implementation, and we understand that. And so in the guideline, there's a section on implementation. There's a table that sort of shows step by step how to implement the program. So we did focus a lot on implementation in this guideline because I do think that is probably the biggest struggle, is getting these multidisciplinary teams to come together and collaborate and implement the standardized protocols.
Absolutely. It's a lot of people and disciplines to coordinate. My daughter had major surgery this past year, and I knew that hospital had worked very hard in their ERAS protocols. And I felt like I got to watch it and how consistent they were in the pre and post-op instructions, because I got to sit in on it, and how they delivered the education in a really consistent way. It was fun to watch that and see how effective it was and make a difference in my family members' care.
Yeah. Well, I totally agree. I was also had a minor surgery in an ERAS program, and the difference that it made was remarkable. So it just proved to me that no matter what setting you're in, this was a small outpatient surgery center, you can implement ERAS protocols and every patient is going to benefit from it.
Great example. So let's talk about the challenges, because if it was easy, everybody would already be doing it, right?
Yeah.
So what are some of the challenges for teams and organizations in moving this forward?
It's interesting, too, that when we did our literature search, there's a lot of studies actually on the implementation of ERAS and the challenges and the success stories. So we were able to learn from those. But I think, again, it's careful collaboration, and the team really has to be engaged and committed to continuous improvement. They really need to be committed to improving care in their facilities. But a common obstacle that we heard was the variation of care driven by physicians' strong personal preferences, which probably is not surprising to any of us. But if organizations base their protocols on the best available evidence, then they shift that focus toward the patient's well-being and away from historical provider preferences. And standardization for the surgical team allows more consistent care delivery as well. So we emphasize those standardized protocols, and that it sort of eliminates that and brings forward the evidence-based practice.
It would seem that in putting together standardization, which is hard, not easy, there's other benefits beyond just to the patient. So I know we've talked about those. Can you share some of those?
Yes, I think, and there again, the studies that supported this were incredible. We had such strong evidence that talked about outcomes and benefits, but giving that consistent delivery of care, and really it's equity in care. And if you are standardizing your care and all your patients are receiving the same standard, they're receiving the same protocol, you are taking a giant step in decreasing healthcare disparities. I think there's a huge research around decreasing in cost and how the reduction in cost at your facility by implementing these programs. There's less opioid usage, which is huge. There's improved outcomes, so many improved outcomes, too many to even go through today, but they are listed in the guideline where hospitals can see here's all the great benefits from implementing an ERAS program.
Getting patients home sooner and healthier is a benefit for everyone.
Yes.
So you've already talked some about some of the patient outcomes impact. It would seem that that should be an easy thing to adopt and to be able to collaborate on to move this forward. What else do you think going forward, how these will evolve? I know we can see a lot in Europe. They've been doing this longer than we have here, but how do you see these evolving as we go forward?
I think the research around ERAS is incredible and it's ongoing and it's very high quality. So I think we're going to see more focused, specialty focused protocols coming out, especially with pediatrics populations. There wasn't a lot of research on that population yet, but also special populations and I would say older adult populations. I think we'll see more how this impacts them differently because they have different risks and different ways of approaching their particular needs.
Right.
And so it is growing around the world. I think there's a lot for us to learn about how these are being implemented in other countries. They're implementing these in other countries every day. It's spreading so rapidly. And I think we can learn from them and learn from their challenges to make this a better coordinated effort across the world.
Amen to that. What kind of responses? This is a new guideline, but have you heard from any perioperative leaders or teams about this so far?
Yes, everybody's so excited about it.
Oh, that's awesome.
I think ERAS was already growing and spreading across the country. What I would like to see, so some facilities have implemented it and maybe just one service line, is we want to see that spread to every patient because, like I said at the beginning, the touch points to the patients in an ERAS protocol, they're so easy to implement. And every patient needs to have them, no matter what type of surgery they're having. So that's what I think everybody's excited about is being able to spread this to all their patients. And that doesn't matter what type of surgery they're having or what type of facility. It's easy to implement this in hospitals and ambulatory surgery centers as well. And I think for us, it's exciting to watch it grow. And it's exciting for us to see how enthusiastic our perioperative nurses are about implementing it.
The consistency just helps us in so many ways, whether it's new nurses or new staff and new providers to be able to move forward quickly that way.
Yes.
Lisa, thanks for being with us today and for sharing all this great information about ERAS, as well as your excitement about the impact it really can have. Thank you all for joining us today. We hope that this has been a helpful introduction to our new guideline implementation of ERAS, and that you too can share some of our excitement about how this can make a difference in your patients' care. You can find this guideline now in your EG Plus accounts and your 2025 print guideline book and ebooks. Thank you again for joining us today, and see you again soon on Periop Talk.